roll call, we don't have, quorum to do the proper meeting or to vote for anything or to, approve the minutes. So we're still gonna have the meeting, but it's just gonna be informal. We do have a presentation from our Laredo Police Department, 911 unit. I know it's very informative, I've already seen it, so I hope, you get some information from it, and we're gonna go on, Earl, you wanna introduce yourself? Sorry.
Earl Medina, District 5, Secretary for DOC.
Dr. Viviana Martinez, Detoxification Director.
Michelle Saldaña, ICT Program and PACE Program of SCAN.
Margarita Garza, Precinct 4, Commissioner of the Community.
Gerardo Sáez, Amacus y Luzmano, Matador County.
Andrea Flores, Laredo 911 Communications Manager.
Shanky Gonzalez, also Laredo 911 Supervisor.
Sheila Flores, Coordination for CAPS, Board Region.
Wonder, Laredo Fire Department.
Catalina Aguado, Border Region.
Nancy Cadena, Indigent Healthcare, and I'm representing Commissioner Tijerina.
Clarissa Cabello with SCAN outpatient treatment.
Frankie Adame with the South Texas MAP program and SCAN.
Gerardo Mayor, Councilman Gonzalez.
Angie,
Angie Flores, Laredo Public Health.
and we have a visitor,
Debbie Sanchez from Laredo Alpha Services. Nice to meet you.
thank you. She's here because, she's gonna be doing the same thing, so she came to see how it works. Okay, for invocation, Pastor Irantes is not here. Earl has a little, invocation.
Let's take a moment and bow our heads. Heavenly Father, we come to you today asking for your guidance, wisdom, and support as we begin this meeting. Help us to engage in the meaningful discussion and guide us through the meaning of life. We ask this in your name, amen.
Thank you all. Public comments, is there any public comments, Angie?
No public comments.
No approval of minutes since we don't have a quorum. Administrative report, Dr. Chamberlain is not here either. Detox facility report.
Aquí tengo mis
Doctor?
notas.
Okay.
It's one of those days. It's
Okay.
Okay. So, to date, the detox has admitted 204 individuals. Referrals, we're at 411 referrals. So as you can see, and this has been a trend, about 50% of our referrals accept, services. That does not mean that we give up on the referrals that we have. We're constantly calling them, and coordinating with our partners. Yesterday we had a patient, so, Frank and us were we were on it, to make sure he comes in. But even if their date comes up and they're not there, then the staff's out there looking for them. We contact whoever the referring agency is, so if we know they have services, then we'll contact their caseworker, counselors, whatever it may be, so that they can assist us in tracking them down. Obviously, this population gets lost quite a bit. So, if I pick up the phone and I let Clarissa know, we have Viviana Martinez that we've been trying to get her, we can't locate her, so if she happens to show up, just give us a call, let us know it so that we can, move forward with the process with them and get them in. And then, we do have, individuals that, are getting services with Be Well, and what is the other one? Novelty. I know a couple meetings ago, Mr. Hernandez mentioned the Vivitrol. We found out that we have been referring to Novelty specifically for the Vivitrol. So if they go and continue their services, we do have individuals in our community getting the Vivitrol from Novelty as a support, and then Be Well is doing the Suboxone. So that's an additional support to what SCAN does, to what our AMA methadone clinics are doing, and other entities. So at the center, we are doing everything we can to utilize and maximize the resources in our community to ensuring that they remain clean and get into services. I do want to share that an email will be sent out when we have to, so we're gonna be in a position where we're going to have to stop admissions. It has to do with their building. It turns out that our generator, is not operational. Right now we have little small backup batteries to be in compliance. But when that happens, they're having to replace it. We are going to have to shut down electricity completely from anywhere to 24 up to 72 hours. Because of licensure, we cannot be operational like that. Anything more than 6 hours without any utility, we have to, move our patients to another facility. And I can assure you guys, if we send 18 to 24 patients to LMC or hospital to continue detox, it's not gonna be good. So what we're going to do is we have already, city management, county management are aware, and we're coordinating with them. So when they tell us that when they're gonna swap out the generator's gonna come, and at that point, that will be, we will take whoever was already ready to come in, and then that'll be our last patient. And then, they already know that they'll have to wait till we discharge that last patient that came in, so that they can come do the work. And then when that happens, and we're already operational, then we're gonna resume, the admissions. I'm sharing this because I'm pretty sure then, individuals are gonna go and say they shut down the detox or this. So, so that our partners know, we will communicate all that to you guys. We're not gonna stop, following up on referrals. But then when that happens again, we're gonna start again from zero and have to build them up. We can do 4 admissions a day because of how long they take to do. And so, again, right, so if we end up at that point, we're gonna, in essence, have a wait list, and that's because we're gonna be forced to have to shut down the facility. So I just wanna share that, ahead of time with you guys. County is telling us that it's probably gonna take a couple more months before that happens. On the good note, you all that are in this, area knows that during that time of the season, the numbers really go down because unfortunately they wanna be out there partying. So it's a time where we don't expect that we're going to have a lot of patients just because that's the trend with them. But when it, but like I said, when we find out when that's gonna happen, we'll send out a communication so that you guys are aware, but we will continue working and accepting the referrals and doing everything to prep them, to be ready for admission. Yes.
Thank you. Thank you very much for that. So you will send us they're gonna send us a.
We'll send a communication when at this point we have to send it because the county said we're not sure when we'll get the part. And then, so when they tell us, when we know the county is ready, then at that time, then that's when we'll initiate the process. So when they let us know, then we told them, once you have it, then we'll let them know. And then it'll probably be anywhere from 2 to 3 weeks, depending the patient, that last patient that came in, how long their detox is.
Was there a generator there already that?
It hasn't been working since we've been in there. When we got in there, they told us, oh, it just needs a new battery, and then that one came in, and they said no, that. So they've been trying to work on it until finally they realized.
That it's not gonna work. Oh,
Yeah.
Okay. Just,
So like, so right now we have like several little mini ones where something happens, but, and obviously the city, cause I've been in contact with city management. We have portable generators should something like that happen, and then we would need to have backup. But in this case, they're telling us everything has to be shut down to do the switch, and it gets programmed that stationary generator, so that's a different process.
Well, thank you for that. We'll be moving on to discussion and possible action. Michelle Saldana with SCAN is gonna share a little bit about Red Ribbon Week.
Yes, I have here some notes, so just bear with me. The Laredo Drug Prevention Alliance of SCAN is celebrating National Substance Abuse Prevention Month and Red Ribbon Week, which is the last week of October, the 23rd through the 31st, and we're actively seeking to reduce the onset and progression of substance use and misuse among youth and adults. So, one of the major emphasis that we're going to be having this month is underage drinking, vaping, marijuana use, as well as underage drinking, tobacco, and opioid overdose. So the National Substance Abuse Prevention Month is a time for communities, like those in Laredo and Webb County to come together as partners, in drug prevention. So we know that this month we need to send a message to the community that, substance abuse prevention works, the treatment is effective, and that people do recover from substance use. I know all of our prevention programs are gonna be working on doing presentations at the schools or out in the community as requested. So please feel free to, if you have any requests, to send them to our office, and we'll assign one of our prevention programs to provide information dissemination or presentations at your schools or other community entities. So again, this, the Red Ribbon Week is October 23rd through the 31st, and we're gonna be having a Red Ribbon Parade and Rally that's gonna be taking place at Martin High School on October 15th at 9:30 a.m. at the gym. So we are encouraging all the members of the DAC to participate. They're welcome to participate. Another thing that we're gonna be doing throughout the month, as we're doing our activities, is posting on our social media on Facebook, Instagram, X, and YouTube. So please feel free to follow us, and so we can see all the work that we're gonna be doing throughout the month. But that's the information that I have on Red Ribbon for you. I don't know if you have any questions.
Yeah. Does anybody have any questions? And I thank you for introducing the substance abuse prevention month information also, because we were like, what are we gonna say about that, but you already included it.
Yeah.
So I don't know if anybody wants to talk or say anything on what she talked about of Red Ribbon. I know I'm gonna be presenting at, I already have a week booked, and even you said it starts on the 23, I think I have like since the 20,
Yeah.
the
We'll do the
before.
same throughout the
Yes.
month of October. If there are any requests, we'll accommodate throughout
Yes,
the month.
yeah, I'm already
Yeah.
booked for that week, so if anybody else has anything, do y'all wanna add anything for that?
Just to know that maybe you guys know SCAN has a lot of prevention programs. I know a lot of them focus like on youth or transitional youth age, but I mean, you all can reach out. It's not just treatment that we have prevention, intervention, now early childhood intervention programs. So there's so many more programs coming in, so if you all have any families or individuals or yourselves are interested in services, I mean, to reach out to us. Yeah.
Thank you. Anybody else? We do have, food today. It was, brought by Dr. Viviana. You all are welcome. We're gonna have the Nexus 911, presentation. Do we need to put anything into the?
No.
So I don't know if people wanna go get your plates and eat.
Yeah, well, we get them ready.
Okay.
I wanted to give an update on the B-Well, because B-Well is giving buprenorphine. Buprenorphine does not have naloxone inside it.
So it's a buprenorphine.
It's the buprenorphine, yeah, so, and they're taking the pill, so just so you know, it's not Suboxone. Suboxone, the one we prescribed, does have naloxone inside it, and so, I know, SCAN and Novelty are prescribing the films, just so you're aware. And then I think buprenorphine is also prescribed to females who are pregnant, so,
It's like a less invasive approach that they give, like if they have a lot of medical issues, like to not have to give so much medication, and for pregnant women on that.
Is that a daily dose?
yes.
Actually, that's what I was gonna ask.
Yeah.
It is, and then the milligrams depend on the patient's usage, right? It could be anywhere from 2 milligrams to 22 milligrams, that just depends on the doctor and who's prescribing the medication. That also do the same thing with the Vivitrol medication as
Yeah.
well.
So it does the same thing as Vivitrol?
They all work the same, like they all help with the cravings and the urges, but the Suboxone is what has the naloxone inside it, so it gives you withdrawal symptoms if you take any other
It's
opioid.
like a,
Yes.
yes. And that's why sometimes, so patients we've heard where they're like, no, this medication doesn't work, or I just want the films, or I just want the pills, because if they use like opiates at the same time, they start feeling sick. So they'll be like, no, it's because that made me feel sick, but because they still have the opiates in their system,
They go into
into
something else.
severe withdrawal. Like,
And I'm sorry, what's films?
But the films are like
The dissolvable ones?
Oh,
like when
okay.
you, I don't know if you've seen the
So
Listerine.
Listerine,
It's like
yeah.
that, yes.
Oh, okay, so they
Yeah.
have it like that. So-
that's
Oh,
how
they didn't know
this
that.
the box.
Yeah, and it's placed under the tongue, and it's monitored. We do what's called a CAL score to see what's going on with the client, what symptoms they're presenting and whatnot.
And do they have to go get it daily like at AMA, or do they get it like,
For us, I can speak for Matt, right, like our program is more so, they come weekly, and then if they're compliant with us, then we put them at bi-weekly, and then it moves up to monthly. We don't just give 30 Suboxone pills, because obviously we can't just say, hey, here's the controlled substance, right? We do 15, and then they would have to call us 3 days before they run out, and then do another 15. And that's to check up on them at the 15-day mark that they're supposed to.
So they'd be able to take it home with them after a certain amount of time?
Correct. And then we do advise them that they cannot, they can't drive with it, they can't, they have, if they are gonna take it in their vehicle, that they have it in a locked compartment, a lockbox, because if they get stopped and they don't have the name or the prescription on it, they can't get arrested for it. So, that's something that's important that a lot of clients are not doing.
I can tell you based on what, we know from you was they do it daily, and then they have to, once a week, they have to do their drug test. So if they fail the drug test, they no longer give it to them, and because then we have clients that come to the center and they're upset because BWO doesn't wanna give it to them anymore, and then we have to explain to them, they want the caseworkers to call and tell BWO off because they need it. And so when we assist them with the call, then BWO will let us know either they failed to show up for the drug test, and without the drug test, they won't, the doctor won't give it to them again, or they failed it. So they do have to monitor them that they haven't, relapsed and used any opioids.
So excuse my ignorance, is Novelty and Be Well a clinic, or is it like a pharmacy, or?
They're both, Novelty is a behavioral facility, so it's, I don't know if you know where we're located, Scan. And there's like a mobile loop in the corner, right in front. There's a plaza, and in the front, that's where Novelty is located.
Right in Ramona or something like that.
Like where Rock Fitness is?
Oh,
There's like
gotcha.
a glass looking.
Yeah.
So they're there, and they're
Okay.
located on the second floor, and they do provide the services, and they have a doctor on site, a psychiatrist, and then they do refer clients to counseling services as well. You do require insurance, just so you're aware. A lot of the times when the clients contact our office, they wanna get service like immediately, and unfortunately, we admit a certain amount of clients per month, and so they may have to wait for that period to come around. So we refer them to Novelty, and then we also refer them to BWO.
And BWO doesn't require insurance.
No.
Do they do like self-pay?
They do self-pay, yes. The client can pay on their own, but the services with BWO are virtual.
Yeah.
There is-
BWO, we don't have,
Yeah.
yes.
Because they're
can we
located in
get some
San
contacts from them, so maybe we can,
Yeah.
invite them next
that would be
month, or,
good.
just so we can know what they do and stuff.
No, because I didn't know that there were other behavioral centers that do offer, not like, I mean, we know Scan and AMA does, right? But like, for example, Vivitrol, we only work with one physician because nobody else really wanted to touch it. So
Yes.
it would be good to be able to connect with like other agencies that could help us out with
Yeah,
MAT.
so we
And
can
they
bring
accept
them.
Medicaid.
Okay.
Medicaid and private insurance
Okay.
for Novelty.
And
No.
with BWO, just so you're aware, they're federally funded, but they also accept insurance. The only problem when it comes to BWO is that they can only provide the medication for 6 months for
Okay.
someone who's not insured.
Insurance.
And so the client would have to be somewhere else. Or if they get insurance, right,
Yeah.
they can continue the service.
And so these clinics, or these behavioral centers, do they require blood work
Yes.
before
Yes.
administering the
And
medication?
Any Metroved, and I can attest to this, and I'm sure, but they all require for you to get
Yeah.
that work. And the reason why is because we have to check their liver, their kidney function, if they have any other issues, we refer them.
How about the storing of the medication? So like, let's say we can purchase Vivitrol and then we work with one of the agencies, would they store the medication for us?
You would, that would be.
I'm gonna tell you, for us, for Scan, we won't store it.
You won't, okay.
We cannot, more so because of the capacity of what it entails, like you have to get licensing and
Yeah.
whatnot.
Yeah,
and,
got it.
EA, all that. What I can tell you is, as you all know, we do we require, blood work for our patients. So what we do is when we're linking them to Novelty and Be Well, that's part of what we send, so it speeds up the process for them, because we provide them with the labs, obviously the client gives us a consent. So then we'll provide them all that, and that gets them started sooner. They're able to skip a couple of the steps because we share all that with them so that they can get approved faster.
This helps also for individuals who maybe work like oil fields or like transportation. So we've done that, we've seen that at SCAN where sometimes we offer the telehealth therapy, but they get used to Be Well because they help them find a pharmacy wherever they're at.
Yeah.
Oh,
That's
everything-
we've had
everything's
several of
telehealth.
those.
and so that's where they would pick up their prescription.
So they're
once it's
from
ready to
here,
go.
they live here, but they get sent out for 14 days or whatnot, so they help them find a pharmacy.
And their sessions are via telemet,
Yes.
so they don't, so when they're meeting with the doctor and that, they just log it into their portal. And we have several that, they say, I don't have a phone or whatever, so when their sessions are, they come and use one of our computers so that they don't miss it.
That's interesting, okay.
And there's,
Well, thank you for the information.
there's other resources, so I guess to backtrack, there's, Bicycle, which is also located in Dallas, Texas, and that's also virtual too, but they do require insurance. There is the Texas Tropical, which is a psychiatric hospital, and then there are also a behavioral health, like Border Region, where they provide med services. There's the CHCS, which is in San Antonio, and they also provide med services. There's a lot of resources, I can send them to you. I can
Yes,
typically
please.
send them to whoever's contacting for med services.
Yeah, because the only MAT program that we offer through drug court is the Vivitrol, but it is difficult because since we do pay for the medication, it's difficult to find a physician that could store the medication and then administer it if, their blood work comes back good
If
enough
you
for the
send me
doctor to
that
clear.
info, we can see what we can do with Dr. Reyes to see if
Okay.
he's willing to, because obviously
Okay.
it falls under his license, but
Yeah.
our center does have the DEA, we got it registered with the DEA and all that, so shoot me an email,
Okay.
and then I can speak with Dr. Reyes to see how we can coordinate with you all, being that we're just next door, we're our 24/7 facility.
That
So
would be
we
great.
can see what we can do, I can't promise anything,
Yeah.
because it's not my license.
Yeah.
But our center.
Yeah,
is
and I know how
DEA.
difficult it is,
Yeah.
to make the decision like that, so.
Yeah,
no,
but
I
send me
appreciate
the
it.
information and see what we can do to coordinate, and hopefully we can make it happen. But we did have to register the center with DEA and all
Okay.
that, because we're considered an MAT.
Gotcha, thank you, I'll shoot you an email.
Yeah.
I'll send the resources to Miss Angie, and then hopefully she can share with everyone.
Sure.
Yeah.
Okay.
Thank you
Well,
guys.
thank you very much, for your written.
We took a little bit more.
You're learning
Right,
about
right before they
resources.
start, the food, it's bonus
Yes.
wings and something.
If y'all wanna get anything before, can you do mine?
No.
Yes, me too.
Because that was information we needed.
They're just gonna get the food in.
Ahí también hay power. Están ahí abajo. No, ya la Clarisa, te digo yo. En el camino me la tuve que tomar. Ya llegó boca.
What are you doing back there?
Es que no tiene, ahí está como se queda pues el tiquis, si no, de modo, let me get in there. Es que si no se nos olvida, alguien la va a pisar. Se va a caer.
So we're here from LPD Communications. We're the people that handle all the 911 calls and the people on the other side of the radios for the officers and fire department as well. So today we're here because we wanted to make sure that everybody's aware of a system that we have. It's called Carbine. Carbine is a system that we use in order for us to communicate. We can send video. I'm not sure if you already knew that we can get video, we can get photos on 911. So whenever you call 911 and you just call the regular line and you don't use the system, we have a way of locating you by way of antennas, right? By triangulating your location by antennas. So our region now has a system called Carbine. In order for us to locate you a little bit better, we have this system called Carbine, and it locates your phone. It gets the GPS coordinates from your phone where you're at. So once we send you a link, you can call 911, and if you want to send us video, let's say you're having a patient maybe that's having an overdose and you really can't describe where he's at, you can't describe what he's going through or so forth, we can send you a link. You call 911, 911 will send you a link, and you'll be able to see either through WhatsApp or through your regular text. And if you see, I'm trying to see if I can get you the link that I have so you can see. Once you get it, you're going to be getting,
It'll look like this. The link, if you receive it on your text, it'll be a link like this, right on your text or your WhatsApp. So all you have to do is just simply click the link, and it'll pop up a window. It is internet based, so you do need internet access on your phone to be able to access it and get and allow.
so once you press on the link, you're gonna get another window, 2 windows that are gonna pop up. You're gonna be giving them first permission for your location, and then you give them permission for your camera. And the reason for the camera is so that we can see the location. If you don't, you have to give permissions to both in order for us to gain access. So once you allow it, then the operator on the other side will be able to see whatever your camera is looking at. So the operator on the other side can see what's going on. If you want to the operator on the other side can take a picture of anything. If you don't know where you're at, the operator on her screen will have you pinpointed as to, it shows like a little phone on the other side, and you'll be able to see the location. It's very direct, it's very beneficial to them, because let's say you're in a 3-story building, it also can give you how high, if you're on the 2nd floor, 3rd floor of the building, and so forth. So it gives us a lot of information as to where you're at. You can give video, and this video, we can pass it on to the paramedics that are en route. Let's say we have a critical incident, like let's say at a school or whatever. We also have the capability of sending this particular link, let's say to the fire department en route, to the police officer en route. We can send these links to them, and they can, as we're looking at them, they can be seeing what they are in case they need to prepare for, what they need to take down, or, I'm not sure what our paramedics would need, right? But let's say for a big fire, they want to know where the fire is coming from, what area, so forth. We can send them so they can start preparing on their way over, or their command staff to prepare to what they need, what type of equipment that you need to take down, anything like that. It also has a very good text, but it's called Silent Chat. So this has Silent Chat, and we use it a lot for domestic situations, home invasions, and we're getting to use them now in school incidents where they're critical. When you don't want somebody to know that you're texting, because when you text, you get a chime or a ding on the other side. Well, with this system, it's called Carbine, and you can still have the video going, and you can still be texting, and you won't hear a chime or a ding coming in. So that's very good for when you're in an incident, when you don't want your partner or maybe somebody to know that you need help and you're trying to get help. You can send the Carbine link to them, request that Carbine link, and it doesn't only have to be a 911. You can call the regular police line and ask for the link. Just give us your phone number with your area code. We send it out, and we can get where you're at, the location where you're at, and we can send you the link, so you can send us video, you can send us pictures, any information that you want to share with us, and you can't talk, you can use this system. We also wanna make sure that everybody knows, because a lot of people don't know that there's text, right? There's also text to 911 that we also have the capability of texting. The only thing that with the text, we cannot triangulate your location. It's not like 911. So we would need for you to let us know where you're at, because texting is just regular text. But this system, Carbine, is great because we get your location, an accurate location, and we get to know exactly if you want to share anything, we can get that information from you all. Another thing that we have is that the operator doesn't necessarily need to see what's going on. We can send a link without the operator for their mental state. If they don't want to see what's going on, we can send a link and the operator doesn't have to be seeing the whole video. And you can let us know what you want. And anytime we send the link is only available for the duration of the time that we're on a call. Let's say the next time around you call us, because a lot of people are like, no, they're always gonna have my location, they're gonna have access to my camera all the time. It doesn't work that way. Every time that you call us and you requested the link, only the time that you allow us to use it, that's the only time that we have access. Once you disconnect the session, we no longer have access to your location, we no longer have access to your camera. And is there anything else that,
Well, if you text 911, you can still get a ping, but it won't be as precise as if you use Carbine. And you can send pictures, and you can send videos, but it's faster if you do it through Carbine, and if you do it through a 911 text.
yes, because if you have a 911 text, let's say if it's after hours and the regional office is not there or I'm not there, there's nobody to access the portal. But if you do it with Carbine, it's automatically, they're seeing it, they can pass the link. We can send the link to our real-time crime center, they can disseminate the information, we can send it to the officer out in the field, let's say on a critical school incident, we can send it and they could be showing us, oh, this is what I'm seeing, this is the suspect, or, you know, this is the person having probably an overdose, or that fell, or something that needs further medical treatment. So these are just some of the services that we have that we want to make sure our communities are.
And disconnected numbers can always dial 911, but they can text 911. Unless they're connected to a Wi-Fi or some internet, then they can get the link through Wi-Fi. Even if they're disconnected.
Your phone needs to have service in order for Carbine to work. That's the only downfall. Any questions?
How strong is the service, let's say for example, like downtown area, like for example, the outlets? Yeah, I noticed, you stated, you could video chat, you could text or anything, especially at the outlets, let's say for an active shooter, scene. You know, yeah, I used to work at the outlets and sometimes the cell phone service wouldn't work because you're right next to Mexico. Will that service be strong enough, or?
It's the same, you'll have your same problems. The only difference is if, let's say you're calling 911, because we do have incidents where you are down by the outlets, close enough to the river, that you'll pick up an antenna from Mexico. If that should ever happen and you want the Carbine link, you can call the 795-2800 number and ask, I need for you to send me the 911 Carbine link, and we can send it to you, and you won't have the same incident because it won't be picking up the antennas from Mexico.
Okay.
Because the Carbine will work whether you're dialing 911 or the non-emergency line. It'll work both ways.
Yeah, all we need is just your full phone number and we send it out. But we do need to make sure that you have service on your phone in order for it to work. That's the main thing, and your phone needs to have service. I know that sometimes when you're in a building and sometimes it doesn't have service, you're gonna have the same issue.
Yeah, there's certain areas in Laredo that there's a lot of blind spots, especially like in the south side, north side, especially inside a hospital, like there's everywhere. So even in the mall, like there's a lot of blind spots in there.
Or units like that.
Exactly.
We're out there, like, can you hear me now? We have to go outside.
Yeah.
Yes, so you'll have the same problem. If the phone works, if you have service on your phone, then you'll be able to use these links. I know that we're working with some of the schools to make sure that the internet works, and I know that they've been saying that sometimes it doesn't work. We have gone to schools, have gone to hospitals and tried it out, and it does work, but like you said, sometimes it's hit and miss, depending on where you're at. So your phone needs to have service in order for this, service to work.
Is it being used a lot? I'm sorry. Is it being used a lot, like now, like let's say, I don't know, can you say, well, we did use it 5 times today or stuff like that, like?
How
we have
often
numbers?
do you use it?
Yeah, how often is it used?
So we use it, we don't use it that often because 911 is pretty good at getting your location, right? But where we use it most is maybe like, truck drivers that are coming in from other cities and so forth that they don't know where they're at. We ask them, like, if they don't know where they're at, let me go ahead and send you the link. But a lot of people, like I said, they don't wanna use it because they're afraid that we are now gonna have their location. So we'll tell them, if you don't know where you're at, I can send you the Carbyne link and I can see your location better. I can see it on the map and I can send you assistance. And that's how you get people to open up and allow you to do this. Because a lot of people are afraid of giving you their location, they think that we're gonna be tracking them for whatever reason, but that's not the case. We only have it, once you put end to that call, that's it. We no longer have access to your phone, we no longer have access to your location or anything like that. But, you know, our culture here, they're not very receptive to, you know, different techniques. They think that, you know, we are calling from the police department, so they're not very receptive to it. But from time to time, we've had success. Especially with, I can tell you a little story that we had. We had 2 juveniles that were being held against their will. Of course, they were, I guess, trafficked over or smuggled over. I'm not sure the correct term. So they were here, they were at a house, they were locked in, and they couldn't get out. They didn't know where they were at. So the little girl got a hold of the phone, and it was a brother and sister combination. The little girl gets a hold of the phone, calls 911. And of course, we kind of know the area where they're at, but not the exact house. So we sent her the Carbyne link. She was able to take pictures of the outside with the phone through the window and through the door. And the officers were able, they knew they were in the area because we kind of knew where they were at. But because we saw the cars and the color of the house next door and the house in the front, the officers were able to locate the house and get the brother and sister out. So it has had success. Not majorly success, but at least those little successes word counts. We've had people that are migrants coming over to the US getting lost and using the Carbyne as well with them. We've helped them that way as well.
Where they're crossing over, all they see is a rock or a tree, and there's nothing else that they can describe, and that we were able to see their clothing, we're able to get coordinates, and you know, it'll ping more location for them to be able to find.
So this is right now the successes that we have, but we're trying to make sure that, you know, we get other things, not just when people are lost, not when, you know, we want to make sure that we can help them either in the medical field when there's somebody's trying to, you know, maybe do CPR, or maybe they think they're having a heart attack, or their, you know, loved one is having an issue medically, then we can maybe provide these links over. But like I said, a lot of people are not very receptive to allowing us to use it. But at least when we've noticed that when we tell them, if you accept the link, I'll be able to know where you're at, and people in desperation will be okay. And then you'll tell them, I'm gonna have, you know, access to your camera, but only for a little bit. But when you start with, I can send you help if you allow the link, and you know, I can get your location, and that's when they're being a little bit more receptive. Instead of when we say, if you give me access to your camera, they'll be like, no. But if they need help, they're gonna accept it because you want the police there, you want the paramedics there, right? So they'll be more receptive to say yes to the link and allow the link and help you in that perspective.
And most of the time, people don't always know where they are. So if you go to a building, yes, you're used to going to Walmart, yes, you're used to going to Target, but do you actually know the exact address of the location that you're at? Not really. Not until something happens and you come to think of it, okay, well, what's that? We answer 911, what's the address of your emergency? Well, do you know your address exactly where you are? Always? Well, no. Well, that link would help, or that text would help. That way we can ping exactly where you are.
Yeah, and a lot of people think, well, I'm here by the Stripes on San Bernardo. Do you know how many stripes are
Where?
I'm at the McDonald's here in San Bernardo, or I'm here at the McDonald's on McPherson, or in Del Mar. Like, people think like, oh, you know, it's this one. I'm like, okay, but do you know how many there are in that street? It's a long street and there's multiple, right? Or I'm at the gas station here by 35. You know how many 35 gas stations on 35? There's a lot. So this is where we use this link, and the link comes into play, and we're helping them. With the paisanos, the same thing. When they're coming in, they're involved in an accident, or the truck drivers coming in, they're involved in an accident somewhere on Mines Road, somewhere on 35. They really don't know where they're at. And when we get them, we tell them, like, could you allow us to get your location? Just press the link, and I can see where you're at, but you need to allow me to see where you're at. And that's how you'll kind of get the people. You need to word it in a softer way so that they'll be able to work with you. Because if not, you can be there 20, 30 minutes and you still can't get the officer there. Because they're like, here, I'm by 35, I can see a gas station, okay, but what else, where are you? And with this, you know, just accept it, and I can see on the map where you're at.
We don't delay any time to getting you at home.
Yes.
Hopefully it works like for those border crossers that are lost in ranches and.
Yeah.
So a lot of those people, sometimes that they're calling 911, they don't have cell service, and you need cell service. So a lot of the times that's what we have. We work with Border Patrol sometimes for them to give us markers or where they're at and stuff like that. But if you have cell service, that's awesome. And I know that across the border, I know Monterrey for a fact has Carbine, and we've had success trying to locate a juvenile that absconded to Monterrey as a runaway. And with the help of the Monterrey affiliates over there, we were able to locate her, and they were able to bring her back too. So we also work with Monterrey like that.
That's great.
Yes. So any other questions, comments? No?
Thank
Well,
you very much. Yes,
Thank
thank you very much for coming and protecting us. Make sure you
I'm just gonna show you how we end the session. So either they can hang up or we can hang up, and that'll completely we will disconnect. They will no longer have access to the phone or the camera. So you can go ahead and try and hang up. Yeah? Yes, please, go ahead. So as soon as one of the other hangs up, that's it. It closes and it just gives you a thank you.
Maybe the people just need more like you coming and bringing the information, we can disseminate it and give it to others that don't know.
Yes.
For
Like
maybe
a
creating
commercial.
flyers or.
Like a PSA or
Yeah.
commercial,
Yeah,
that would be nice.
PSA, yeah.
Yeah.
Because if you see it on TV, then knock on wood, whenever you're in an emergency, you will kind of already know.
How long has this been implemented?
We've already had it for about a year and a half, but we were working on a lot of kinks on it, because on our side, we had a little bit of kinks, and then when people, we found out a lot of things that are good with it, that were not good with it, we went back and we were going back and forth. So now we're trying to put it out there to the community, making sure, because a lot of people also text 911 that they need help, and they sometimes say people, I was surprised that sometimes not even all our officers know that we have these capabilities, because, you know, they think, oh, once we call 911, you get our address. Yeah, we do, but it's only a triangulation, we don't get an exact address. This is much better. Texting, you don't really get a good, accurate address when you text, so it's not always, we always tell you, don't text, just call me. And then all these abbreviations that a lot of the younger generation use, that, what are you trying to say? Like, you know. So that is another obstacle that we encounter with the texting. Some of the abbreviations that, you know, you might know what you're trying to say, but we don't know what, or we might misunderstand what you're trying to say. So it's always good to have these different dialogues and to make sure that people know that when you're texting, make sure that you're, you know, typing what you're trying to say, so I won't misconstrue something different than what you're trying to say.
That's very good.
Thank you.
Thank you, yes, thank you very much. Thanks. And, we have something from Ms. Adriana.
Hi. I'm sorry for being late. I was at the
Bethany House with the closing ceremony.
presentation of the health departments inside, the Chamberlain South. So we were representing there. And the only update that we have is the logo. I don't know if, all of you have already opened that link to vote on the new logo? Yes, all of you are aware that we're working right on the new logo, yes? So on our next meeting, we can unveil the winner, which would now be the logo of the coalition. Do you have any questions on those?
Who's voting on the logo? Is it just us or?
Everybody, they send it.
Public?
It was sent out.
No, I
Yeah,
got it,
but
but
it's only the distribution.
like, do you need us to share it with coworkers or anybody? That's kind of what I'm.
No, but who votes?
Miss Angie has a list of.
Yeah.
You can share it if you want.
Okay.
Well, if you want any other members of the community to vote on it, that's what you're asking.
Well, I just wanted to see if you all are encouraging us to share it and get other
Well, it's
feedback,
really
or
up
just
to-
limited to us.
It's really up to the community to decide who you want to have a vote on the logo.
You send it to all the people that scan.
Exactly, like, if you send the link to like the health department, everybody in the health department can vote on it, so it really depends on you guys, who you wanna share
The
the
commission.
link with, yeah, who the commission wants, so we might wanna discuss that right now.
We can't vote on it.
Oh.
Yeah. But, yeah, I'm pretty sure, if you all work at SCAN, you can share it for us.
Yeah.
If anybody wants to share it to some, like if somebody wants to vote, yes, you all can.
Perfect, so yeah, so mainly, or everybody that's in the email distribution list, should have gone in that email, so you can forward it to whoever you feel, has a stakehold or, you know, understands what the,
What we do.
commission is and what we work for. And they can, of course, vote on it. But we already got the first numbers,
Feedback.
checking in, so we already have like runner-ups and things like that. So I just wanna make sure that everybody has a say on what the logo is gonna look like. And the other thing is that, if you haven't, included your information as an agency in the resource list, we wanna present the resource list next month. But if we don't have your information, you're not gonna be in the resource list or in the resource guide. So if you haven't done that, like you can either email me, just to make sure that you're getting the link, or if not, if you want, you can also just give me your information right now, and I'll make sure to share it. Like for example, for SCAN, I know that we only have one of the many services.
See, I think we wanted to split it.
Right, we were gonna split, but can I send you an email just so I can give you all the?
Yes, exactly, because I don't know how many services you wanna
We have
include.
over 43.
Yes, I was, I know, we can have.
Programs. We're
Well,
not gonna
we
drop
all-
43, right? But,
Everything pertaining to.
But I think in the mock that they had showed us, it was like youth, adults, or something like that, right? So we can do that, and then, like, I'll get the youth call, you get Matt,
Yeah.
and then that's the adult, and then we can refer to anybody to
Yeah.
meet within the agency.
Yeah, same way that.
Maybe that's easier.
You got it.
Yeah, we have 4 instead of 43, but yes, I'll send you.
Yeah, and if anybody else you guys can also email me to make sure that you're included in the resource guide.
Well, I didn't know one thing, I think on mine I have to get it updated, because you put me in the children, and we will provide, some options, so.
So you're in the, well, yeah, we'll connect and I'll show you what information I have. Okay?
Perfect, okay, well, thank you everybody for coming, and like I said, there's food, go ahead and take some, our
Yes.
next meeting is gonna be.
I don't wanna have to
November-
take it back, so
Yeah.
please take it.
Our next meeting is gonna be on November 13th. I'm not gonna be here, I'm gonna be in Washington DC. I'm gonna go represent the drug and, I'm gonna go and represent DAC too, but I'm gonna be there with the Drug and Alcohol Administration.
Quemada.
Yeah.
Quemada.
So we wanna adjourn and we'll see you next month.
Thank you.
Thank you.